A very good afternoon and welcome to everybody joining us at the first of our two Overview and Scrutiny board meetings today on Monday the 18th of May 2020 at Bournemouth, Christchurch and Poole Council. This is the second of our virtual meetings, and we have two meetings today, one at 2 p.m. and a further one at 6 p.m. The first meeting that you're joining us today will primarily deal with the Council's response on COVID-related items. So I will kick off the meeting. Obviously, welcome to everybody, all of the board members, all members of the council, officers, members of the press and public. Thank you very much for joining us. As mentioned, this is a virtual meeting, so we will be, it is a formal meeting, so although it is virtual, because of the government's legislations around virtual meetings during the COVID crisis, we are essentially running this meeting like any other Overview and Scrutiny board meeting, except that obviously everybody is joining us virtually. We do have the ability to make formal recommendations in all of the usual ways as we do in a board meeting, a normal board meeting. So thank you to everybody for joining us. First of all, I will deal with some matters of housekeeping, and I'll read out a housekeeping notice for all of those joining us on the call. So please note that this meeting of the Overview and Scrutiny Board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure that the meeting is managed effectively, please could everybody present follow these ground rules for speaking. Firstly, please only speak when invited to by myself as chairman. Secondly, if you could state your name before you speak, if you have not been introduced by name. Some people are dialing in remotely and actually without the use of video, so that would be very beneficial to know who is speaking. Thirdly, if you could mute your microphone when you are not talking to avoid any background noise. Next, if you would like to speak, for those of us participating virtually in the meeting, if you could type the letters RTS into the instant messaging section, that means request to speak, and that will enable myself as chair to note that you've indicated to speak. It also may be helpful if you are able to indicate the particular issue that you wish to speak on to try and maintain the flow of the meeting as well. Furthermore, if there are any recommendations moved that require a formal vote, these will be carried out by myself as chairman, asking for a response for or against or abstain of each councillor that's joining us on the board. The regulations governing virtual meetings require all participants to hear and be heard throughout. Therefore, when voting, I'll be asking participants to do so in acknowledgement that they have heard the debate and been engaged in the meeting throughout in accordance with the regulations. If you do not feel that this has been the case throughout the meeting, please alert me using the chat window and therefore abstain from voting. And finally, should the connection of myself as chairman be lost throughout the meeting, the vice chairman, Councillor May Haynes, will take over. A short adjournment will be agreed until connection is resumed. Viewers of the live feed at that point may see a holding screen throughout any adjournment. And then finally, as mentioned previously, if we could keep any background noise to a minimum and ensure, as always, that mobile phones are turned off or switched to the silent setting for the duration of the meeting. Thank you very much for bearing with me on those housekeeping matters. I'll now formally go into the agenda proper, and the first item of the agenda is apologies, and if I could pass over to Claire to read the apologies. Thank you, Claire.
Thank you, Chairman. We have apologies for this meeting from Councillors Pete Miles and Rachel Maidment. The second item of business is substitute members, and we have a Councillor Richard Burton to replace Councillor Rachel Maidment at this meeting. Thank you.
Thank you very much, Claire. Item 3 on the agenda is declarations of interest. Could I ask if any councillors have any disclosable pecuniary interests or any local interests on any items of the agenda for this meeting? I have Councillor Brooke.
Fine, thank you, Chair. It's a little bit obscure and it is for transparency. I have a local interest in the Children's Services Capital Programme Strategy, which I think is item 9 on the agenda. I'm a member of the Castleman Academy Trust, which is located within North Poole, and North Poole features within the paperwork. Thank you.
Thank you very much, Councillor Brooke. Do any further members of the board wish to indicate that they have any interest to declare? I'm just checking the chat window. That looks like a no. Thank you very much. In which case, we'll then move on to item 4, which is minutes and action sheet. The board are asked to confirm as a correct record the minutes of the meeting held virtually on the 20th of April and to note the board's current action sheet. Does anybody not agree to those minutes and action points? That looks like a no. In which case, thank you very much. We'll then move on to item 5, which is public issues, and I will ask Claire to update on any public issues. Thank you, Claire.
Thank you, Chairman. In order to ensure public issues can still be addressed whilst meetings are being held under the COVID-19 local authority meeting regulations, all public questions, statements or petitions will, whenever possible, be circulated to the board prior to the meeting, and responses will be published on the Council's website and referred to at this meeting. I can confirm that no public questions, statements or petitions have been received for this meeting. Thank you.
Thank you very much, Claire. So we'll move on to item 6, which is the Chairman's update. I will keep this brief. First of all, once again, welcome to everybody. We are getting used to these virtual meetings now, and in many ways certainly can be preferable. So thank you for bearing with us once again as we kind of struggle to make our way in this very new world for all of us. Just a very brief update from me on a few points. Firstly, around the how the meeting is running, and indeed how scrutiny is running during this COVID crisis. I updated the board at the very first meeting that we were trying to find a new way to enable active scrutiny to take place during the COVID crisis without using any more resource than necessary. Under that proposal, and again working closely particularly with many outside bodies such as the Centre of Public Scrutiny, I have been working very closely with the chairman of the other scrutiny boards, most notably the Children's Services and the Health and Adult Social Care Committees. What we tried to do in that process, they've had a few of their board meetings cancelled because a lot of the items that were due to be on those meetings have been postponed due to the crisis, and also working collectively, it seems better to try and focus the scrutiny of the COVID response items into one place. So once again, thank you very much to those boards, and in particular the chairman of those boards, for continuing to work closely with the Overview and Scrutiny Board as we undertake the necessary scrutiny around the COVID-related items at this stage. Obviously, as things start to move back to a little bit more business as usual, and items do start to get put back onto the forward plans of those boards and committees, I do expect that they will start to meet formally again. But of course, in light of the fact that we continue to meet regularly once a month for the Overview and Scrutiny Board here, it does enable us to continue to react accordingly on those issues in those two areas if we do wish to. So thank you once again to Councillor Lisa Northover and Councillor Richard Burton, and who will be joining us today for those respective items. Secondly, just some feedback from the last meeting. We've been obviously all finding our own way in this new world of virtual meetings. I think it's safe to say that the last meeting was relatively long. I think that was probably necessary in terms of the amount of scrutiny that we had to get through because of the amount of different areas that we're looking in terms of the Council's response to the COVID crisis. My hope is that this meeting can and should be significantly shorter, not least because what I will be looking for and what the board will be looking for from the updates, particularly from the cabinet members and service directors around the COVID items, is very much an update on what has changed since the last meeting. So I think it was necessary to have the length of time that we did at the last meeting to really explore what had changed, and obviously the impact that COVID has on the council to that date. We're now 4 weeks on, so we'll be looking at moving forward and seeing what has changed in that period. So thank you all once again for bearing with us, and again, a lot of the feedback I've had from those that have been taking part has been a very well-run, fruitful process. So let's hopefully we can continue on that basis. So I'll now move straight on to item 7, which is scrutiny between board meetings. Colleagues will remember at the last meeting we undertook to have a special working group, particularly around the issue of PPE, and I was very pleased that Councillor Northover, who's the chairman of the Health and Adult Social Care panel, led on that piece of work. Ultimately, I think this was a very good demonstration as well of how we can can use these new functions, particularly around working groups, to really dive deep into various areas that we need to look into slightly deeper, but also not take up any more officer resource than necessary. And I think we demonstrated with that working group that is possible, and therefore if we do find out through the conversations in today's board meeting that we do want to look at any further areas that we want to look into on a task and finish basis, I think we can now enter that into some satisfaction, knowing that we can do so effectively and also not use up any more resource than is necessary. So I will now pass to Councillor Northover to update us on the outcomes of the PPE working group. Thank you, Councillor Northover.
Thank you, Chairman. So just carrying on from what you were saying there, so I went back to the Health and Adult Social Care Overview and Scrutiny Board members to ask for volunteers, and had Councillor Evans and Councillor Matthews came forward to work with me on this. We really wanted to make sure that the working group didn't create any extra work for officers, and also we were very aware that because of the speed of change at the moment, this was very much a snapshot of what was happening already a few days ago now. So what we planned to do was identify between ourselves what our main areas of interest would be, and then have a Skype meeting with the relevant officers and yourself. And so the areas we looked at were the current guidelines to really understand properly what they are and where you can find that information and how that is interpreted, the availability of PPE, the supply chains, and any schemes put in place by the council or the government, and then staff welfare, understanding if they feel safe and if they have concerns, what can they do. So we had our Skype meeting with our officers, and the findings of that have been circulated. So I won't go into the point by point what those findings are, but I would say overall we were really reassured that the council is making good arrangements for dealing with this, and as things move on, that groundwork that has been done to this time is good preparation for future changes, I think. And I also just would like to say I think the working group method really worked well. I'm happy to have questions about the process, if there are any.
Thank you, Councillor Lisa Northover. Yeah, I would agree. I took part in that working group, and I think it was certainly as a process a very good model for how we can do things at this time in the future. I would ask members of the board if they have any questions, either particularly around the process or indeed any comments about whether we are satisfied with this piece of work, whether it's something that we want to look into any further in the future, and if so, how. I have Councillor Haynes indicating. Councillor Haynes.
Thank you, Chair. It's just a very quick question. The paperwork, or rather the summary of the working group, only came out literally about a couple of hours ago, so I've not had a chance to read it properly. So hence my question the answer might actually be covered in that, but I'll ask it anyway. Staff at the care home, they've expressed that they feel unsafe. So clearly it probably isn't from the fact that they haven't got adequate provision of a PPE. But do you know why they say they're feeling unsafe? Any particular kind of reasons, and more to the point reasons, or rather causes for concern that we as a local authority might be able to help them with to overcome?
Northover, you wish to respond?
I think that I wrote there on the first point that it may well be, and we couldn't go into depth of speaking to people directly, so this is just an assumption that people may feel that they're unsafe even though they have the adequate amount of PPE as the guidance says, but they still may not actually feel personally that is enough. So yeah, so it may be that people still do feel unsafe, and we did look also at if they actually feel that they haven't got the right amount of PPE, there is ways that they can bring that up with their employer or eventually through the CQC as well. Does that cover what you mean, or do you think there needs to be further looking at that?
Councillor Haynes, do you wish to come back?
Yes, thank you, Chair. It sort of does, but I guess again, this is making a big assumption here that the people, the staff at care homes are feeling unsafe because of the unknown, I guess is probably one way of putting it, that it's not because of lack of PPE. Is it because they feel the PPE might not be up to standard, or is it just a fear of the unknown that even with the best PPE in the world, they are not, it will not protect them 100%?
Before you come in, Councillor Northover, if I may, I took part in the working group as well. I think it's a very valid point. I think one of the things that we tasked ourselves to in the working group, particularly having had concerns raised in the last Overview and Scrutiny Board meeting, was to really look and see if there's any truth to the some of the things we were hearing about was there adequate supply in the care homes, particularly those for which the council have responsibility. I think the working group got some real assurance there that certainly from a looking purely at whether the facilities and things were there, that was the case. I think equally there is a big question about you know, why people still feel very anxious about this. Councillor Northover, you wish to add anything further?
I don't think I've got anything more to add because we haven't actually been able to speak directly to workers, so it's a difficult thing to comment on their behalf, I think.
Thank you very much. I've got a few other people indicating they wish to speak. Also, just addressing your point, Councillor Haynes, about the results of that working group not being published till quite late on. I think it did get a little bit lost in the system, partly potentially my fault. I know we were intending to circulate it through the board, and it was noticed quite late that it had gone to some people and not others. So kind of general apologies for that. I have Councillor Dedman. Councillor Dedman.
Yes, thank you, Chairman. So you've taken the words right out of my mouth about circulation. You've apologised before I've even said anything. Yes, it would have been really, really helpful to have had that working group result prior to this meeting, because I do have things in my own little section to have addressed some of that. So I won't go on, but yes, can we please have that circulated? I'm really interested to see what the results were. Thank you.
Thank you, Councillor Dedman. Councillor Farquhar.
Thank you, Chair. Bit of a problem with video, I think. Yes, no, I just wanted to, I might have missed it. Is this results of this working group going to be made public, and if so, when?
Thank you very much. Councillor Northover?
I think, did we agree that they would be added to the minutes of this meeting? That's what we said.
Yes,
but it can be circulated to all councillors, I think, in the meantime.
Yes, I believe so. My understanding, unless I'm going to be corrected by anybody else, is that when the board resolves to undertake a working group, we go away, we report back to the board. I think the minutes here, which were prepared by the members themselves, were to kind of aid the discussion and help with that. But I'm pretty certain that they'll be added to the minutes as well. Do I have any? Oh, Councillor Stephen Bartlett. Councillor Bartlett.
Yeah, hello Chair, thanks a lot. At the last meeting I did express some concern about the difficulty that private carers were getting access to PPE, and following the meeting I was contacted by an officer from the council. I have to say, I'd like to say a big thank you to them for helping out in the way that they did, because the council were extremely cooperative, and the people that were looking for assistance with PPE did actually receive some excellent service from them. So thank you very much.
Thank you, Councillor Bartlett. I don't have anybody else indicating they wish to speak on this item, so I will draw that to a close. Thank you again to Councillor Northover for taking the lead on that. And as I had indicated earlier to board members, I think particularly while we're in the stage of social distancing and virtual meetings, the ability to undertake these short, sharp pieces of work, which are not at all intensive onto any of the staff, could be a very good way to fill the gap between meetings, particularly if we find other issues that we think may need escalating. So thank you to all members that took part in that effort. I'll now move on to item 8, which is the Council's response to the COVID-19 pandemic. Similarly, as to the first meeting, the intention here is to look at the Council's response through the different service areas, not replicating all of the service areas that we looked at the last meeting, and actually adding a few that perhaps we missed out on last time. We have asked for questions in advance which were specific operational questions, which might well have been detailed. We did get a number of those at the last meeting. We haven't had any this meeting, which I think is positive news, and certainly anything that can be raised in the formal meeting as a preference there that it should be. And what I will ask as we go through each of the areas is that we try and keep the updates a little bit shorter than we had the last time, maybe 5 to 10 minutes from each of the participants for an update to enable us to have more time for questioning. And again, as per the beginning of the meeting, I think what the board would find extremely useful is to have an update on what has changed since the last meeting, rather than a rerun of the full Council's response. We are also within this item considering 2 cabinet papers, which are the first one from the Chief Executive around the Council's overall response, updated on the COVID-19 pandemic response, and secondly, as we'll get on to a little bit later, the financial paper as well. So without further ado, I will go to the first section, which will be an update from the Leader of the Council, Councillor Slade, and the Chief Executive, Graham Farrant, just to give us a little bit of an introduction, A, to the paper that's going through Cabinet, and B, to the update on a full Council basis on how the Council is responding since the last meeting. So I don't know which of you would like to go first. Perhaps I'll call on the Leader first, Councillor Slade.
Thank you very much, Councillor Broadhead. The Chief Executive is actually going to give you a bit of an operational update, and I'm going to cover some issues around community democracy and how we're working with our partners, but being minded that I don't want to cover all ground, and I don't want to stray too far into what the different directorates are doing. So Graham's going to go first, and I'm going to pick up on the bits that he hasn't covered, and then obviously questions.
Thank you, Councillor Slade, in which case I'll pass over to the Chief Executive, Graham Farrant. Thank you.
Okay, thanks, Chairman, and thanks, Leader. I think the report sort of sets out quite a lot of detail about what we're doing. I would say what we've seen over the last month since the last report has been a development of all of those areas. There are fewer new things that have been coming in during that period, but more a consolidation. So at the moment, this feels like the way we are working. It doesn't feel so much now like a very short-term response to a crisis. It does, however, feel like a very long-term response to a crisis. And I think at the last meeting I described that most emergency structures are designed to deal with a point response. So there is a point emergency, and then we move very quickly from the response phase into recovery phase. We said then that this was one of the longer emergency responses, and it is still ongoing. And in some areas, of course, like adult social care, and particularly around care homes, that has been ramping up more over the last couple of weeks than maybe at the beginning of the period. So we're seeing some of that focus change. In terms of the structure of how we're dealing with it, we're still working within the local resilience framework, so working with our partners across Dorset through a strategic coordinating group that now meets 3 times a week, a long meeting on a Wednesday with shorter meetings on a Monday and Friday. I think that will gradually reduce over the next few weeks now, because we tend to be dealing with the impact of issues, ongoing issues, rather than new issues coming through. Within the council, we have a corporate incident management team, which is now also meeting 3 times a week. And again, we've talked this morning about whether we look to reduce that to 2 meetings a week going forward. I guess the context within which we're working as well is that there are lower infection rates for COVID-19 across the southwest, and actually quite low in the BCP area as well in comparison with the rest of the country. So infection rates roughly about 1/3 in our area compared with some other areas of the country. So we're talking, I think it's about 136 infections per 100,000 people, which is sorry, to be correct, for BCP it's 117 per 100,000 people. Nationally, the figure is 256 per 100,000 people, so we're at about half the England average. We know some of those peak areas have been getting over 300 to 400 cases per 100,000. So within that context, we believe that our measures have been effective. We believe that we've had a good response from the community, and the partners, I think, are working well. It is worth saying that I get a national survey from the National Leadership Centre to complete every week, has been so far, and the area that I give the strongest marks to are the way that we're working across the sector and across the whole of the public sector. I think that has really benefited during this period. So we're now seeing very close working with the police, with health, and with Dorset Council as well. So there is some strength coming out of this that we need to maintain. We've also, I would say, got a higher profile for BCP Council and access to national decision makers. So, for example, I'm now one of 3 chief execs that supports the Southwest, feeding into a regional call with MHCLG. So I'm taking part in those every 3 weeks, and that's a direct line into those that are shaping policy in central government, and that gives us good access and good information. We've also got good coming together across the sector through the Southwest Chief Execs, which has really stepped up, and also Southwest leaders now taking a stronger line. So my sense is this crisis has brought us together more strongly. We're seeing very common issues across the Southwest, common ways of dealing with it, and therefore we're being able to spread good practice wherever we can. In terms of our own operations, you'll now see some of those services beginning to be stood up again. So we stood up the household waste recycling centres, got a very good response. I guess, as you'd expect, the Monday was busy with at least one car queuing for 2.5 hours before the site opened. But by 5 o'clock that evening, we were reporting much lower traffic volumes. And in fact, during the week, those have gradually stepped down. So we're now seeing a more normal, almost weekend use of the household waste recycling centres. We've brought back the green bin waste service. As people know, we're beginning now to look at our other services and step those up. The car parks have been reopened. And again, even over this weekend, we had a good response from the public. We had a responsible approach to social distancing as far as we could tell, and threats of a protest, which were of concern to ourselves and to the police, effectively became a pretty small event, shall we say, and therefore less concerns. So the service impacts are mostly in the report, and you're going to pick those up through the individual subjects. There's probably not much more I want to say. We have seen some really good response. I'll just say the mortality support that we provided, which is effectively an extension of the mortuary service. We set up a temporary mortuary service at the Port of Poole, really good cooperation with the port. Kate and her team worked and got that set up within a week. Getting it all set up. We're now decommissioning that, getting some long-term support from MHCLG, and that will be there if we need it, rather than being available and working all the time. So you can see the response developing and evolving as we go. Actually, I think we're in a reasonably strong position in terms of our services. The area of concern, of course, is the council's finances, and those are dealt with in a separate report, which we'll be picking up later on. So that's probably all I wanted to say for our introduction. Happy to hand over to the leader.
Thank you very much for that, Graham. So just to give you a brief update on the other side of it, as Graham's indicated, and we have talked about the number of people that have been redeployed into other roles. At one point, we had over 600 staff who were spending some or all of their week doing a different job to that which they're normally doing. That is beginning to reduce as more services are stood up, and where there is a comment about why something hasn't been reinstated within a day or two, it's generally because actually staff are doing something else, and we need to make sure that we don't put that other service at risk. For example, over 300 members of staff have helped with the community resilience response, and as we move that into more of a business as usual, we need to make sure that we don't undermine the ability to have that running 7 days a week, 8 till 8, as we've committed to do, and so it may take a little longer for other things to reinstate. What we have done, though, is we have reinforced our message that staff should work from home wherever possible. This obviously will allow us to keep our cars off of the road and keep people working in a safe way. It will also help to facilitate longer term change to the way that the council operates. So I think that's a really useful thing to reinforce. We're working within the local resilience forum, but we are progressing our own way forward. So wherever something is internal or where it's a BCP way of doing it, we are demonstrating that we work with our partners and with Dorset Council, but we don't always make the same decisions. And last week's a prime example that we took a different decision about how we would use our facilities with regard to our car parks, our toilets, etc. I believe that was the right decision. I'm quite happy to take questions on it later, but it demonstrates that we are sovereign councils in our own right, and sometimes we'll take different decisions for different reasons. The other things that I want to just quickly cover is I'm absolutely committed that we maintain a high level of democratic engagement. So I'm working closely with the monitoring officer to restore meetings over the next couple of months as it becomes sustainable for us to do that, making sure that we can balance the needs of our officers to not have that they have sufficient capacity to do that, but that we return to a new sort of normal. And as we all become better at doing this, that will become easier. We're also really keen to maintain the levels of community engagement that we've done, committing to retain the Facebook Live Q&A, retain the community resilience hub in a business as usual style, and introduce more innovation in how we engage. So, for example, much more interactive engagement around how we create more space for pedestrians and cyclists, how we use more apps. We're beginning to use artificial intelligence in pool in the lake, as you will have seen, and we're beginning to develop apps around how we monitor how busy different parts of our town centre are. We're continuing to challenge all spend, so that decision making is going through the CIMT to make sure that we are keeping a tight rein on that. And the work around reimagining and resetting our town centres and our hospitality and our tourism markets is starting in earnest. We've had meetings with business groups and other business sector groups, which is developing a plan which should come out in the next couple of days. Continuing to lobby, we're doing a lot of work with our MPs, and I'm delighted that finally the Unitary Councils Network has managed to get itself onto the fortnightly calls with MHCLG alongside the County Councils and Districts Network, partly because of the lobbying that we've been doing. And the MPs have been great. And the other final thing just to cover is that the business discretionary grants, we are close to developing a scheme, but it is going to be a couple more weeks yet before that goes live, because unfortunately the guidance that arrived 2 weeks after the announcement was made is far more complex and far less discretionary than councils were advised it would be, and is involving a lot of close work to make sure that we are able to deliver a scheme that's going to help the people that need it most. But very happy to take questions on any element of that. Thank you.
Thank you very much, Councillor Slade, and thank you to the Chief Executive as well. I will pass over to colleagues from the board to ask questions, with the caveat that obviously as we go through the meetings we are exploring some of the different sectors in slightly more detail. In particular, we're looking at children's, the area of children's services, health and adult social care, tourism and leisure, and housing. So at this stage it'd be useful for any questions to be directed particularly to items outside of those areas. So I have a couple of indications. First of all, Councillor Haynes. Councillor Haynes?
Thank you, Chair. It's probably a question, probably more for a Chief Executive. In the introduction to the written report, paragraph 3, there's reference to an initial recovery impact assessment, which should be available by the middle of May, which is kind of where we are. So I'm wondering whether Mr. Farrant's able to actually give a little bit more detail on that subject.
happy to respond. Yeah, thanks, Chairman. That's something which we're still looking at. We're working with the LRF, and I think actually there's a meeting of the recovery cell today, I think, which Julian was taking part in. So I don't know whether Julian has an update rather than me giving you a version from prior to that meeting at all.
Julian Oscarthorpe?
Yeah, thank you, Chair. I don't have any, there was no material change. It was discussions around the production of the process, which should be available later this week, Graham. It's probably not appropriate at this stage for me to comment in a public meeting as to the content of that conversation.
Okay, apologies. I wasn't sure if I'd give an update. But
Graham, can I just make that really clear that that is the LRF's RIA, not BCP Council, so it doesn't belong to us.
Thank you, Leader. Hence my comments that it's probably not appropriate until the output from that meeting is available for me to comment on it.
Okay, the other thing I was going to say is I know that South West councils are also appointing some consultants to help on the economic impact assessment across the whole of the South West, where I think they're just in a position now to let a contract for somebody to do that bit of extra work. But of course, that work will take a few weeks to come through.
Thank you very much. Councillor Iyengar.
Thank you. Councillor Slade, you mentioned the car parking and the fact there may have been different views from the different partners, which I think we knew. It has been reported media-wise. Can you summarise what were the sort of the main pros and cons in that discussion, and what kind of finally decided it for you in the way BCP went with this decision?
So basically, the conversations took place with ourselves, Dorset Council, and the police. Including the Police and Crime Commissioner, and fundamentally the words of the Prime Minister led us to conclude, and this followed a meeting between the police chiefs and the policing minister, that the police had absolutely no powers to prevent anybody from travelling anywhere within England within the distance they could travel and return within a day. We had some quite robust challenge with some of our MPs saying, well, we should be able to stop people, we should be able to turn people round, and we were told absolutely categorically no, the police could not and would not do such a thing. Their only powers were now around who you're with, not where you are or why you're there. So what we concluded was that we are still putting out a message, and if you live outside of this area, the messaging you'll see on social media about the whole of the area is please come back later. That is the social media message, and we're actually paying, our comms department are actually targeting that social media outside of the area with that please don't come now, come back later. Locally, the message is think twice, too busy, go home. So it's very much that if you drive from Kingston to the beach and it's packed, turn around, go home again, take some personal responsibility. So what we concluded was that the police would not help us to manage anything other than specifically located problems. They would not turn people around from out of the area. We had a choice, being a very different community from Dorset, of accepting that people would come and either parking them safely off the road somewhere which didn't cause too much impact to local people, or accepting that they would park wherever they liked. If they travelled a couple of hours, as we saw on the TV at the weekend, some of them have done, the fact that they might get a parking ticket would probably make no difference. And therefore the conclusion was we would make life easier for local people by opening them. The other really important factor is that we live in an urban environment where everybody in our area lives less than 10 miles from the coast, but most of them live more than a mile from the coast. And so the vast majority of people who would want to use our car parks at Upton Country Park or at the beach or elsewhere will be people from BCP who have been up until now told you can only walk somewhere, that you can only exercise somewhere within a walking distance of your own home. So opening up our car parks primarily helps local people. By default, it enables there to be somewhere safe for other people to park. and we can't turn them away anyway, even if we wanted to. And I think we've made the right decision. I have heard of some pretty nasty parking chaos in Dorset, with people parking on grass verges, people blocking roads. Here, we've had a well-managed car parks where generally speaking, they have not been over full and people have behaved in a responsible way. So I'm content that that was the right decision at this time. We do have a meeting with the MPs this evening, and the agreement was that if Dorset had become overwhelmed, they would lobby their government colleagues around a distance restriction, 30 miles from home, whatever it might be. And it remains to be seen whether any of the MPs are feeling that way this evening. That will be for us to lobby them accordingly.
Thank you very much, Councillor Slade. Conscious that we need to start moving through the agenda, so I have one final member of the board that wishes to ask a question. Councillor Brooke.
Fine, thank you, Chair. Just open the video. There we are. Yes, it refers to the Chief Exec's report to us on paragraph 9, which I think is on page 15 of our agenda. The question may be for him to respond to, or it may be more appropriate for Sam Crowe to answer if he's available. It's around testing. We all welcomed very much the arrival of a testing station at Creekmore Park and Ride, and I think the Council and NHS did well to set it up as quickly as they did. But the Chief Executive makes reference to the fact that there were relatively low numbers of staff needing to be tested for COVID, and I just wonder whether that was extended right across the area. My presumption is that it was a relatively low number, and that raises questions about the future of that site. So, have any plans been drawn up for contact tracing and tracking in order to prevent a second and perhaps worse spike in infection rates, or is that still to be considered? Thank you.
Chief Executive, do you want to come in there? I was intending on inviting Sam Crowe in shortly afterwards, so that could work quite well.
That would be really helpful. Thanks, Chairman. So I think that the numbers are reflecting the low infection rates across Dorset and the southwest generally. The essence was to try and get these testing centres to be within 40 minutes drive time, 45 minutes drive time. So strategically, it's an important site for serving effectively Dorset Council and BCP Council residents. I just want to pay tribute to the fact that we identified this site as a potential site on the Tuesday evening, and it was open by the Saturday. So really, really quick response from the council and from the health services and NHS nationally as well. But that allowed us to really get that moving quickly. But yeah, my sense is that we've not seen great numbers of infection rates in this area. The testing, of course, there will be testing, tracing, tracking are all coming through now, and I think that's what's probably going to change and sustain the need for those tests. At which point, I think I will hand over to Sam to give us the latest on where we are with those initiatives.
Thank you very much, Chief Executive. If I could bring in Sam Crowe from Dorset Public Health to answer this question, but also any other information you wish to share with us. Thank you, Sam.
Thank you very much. I think Graham's right, that this was the standing up of planks in our strategy, if you like, for living with COVID. So as part of my general update, I was going to say that I would agree it feels very much as if we're moving from the acute phase of the response to planning for the longer term. And as we respond to the National Plan for Recovery, what we're trying to work out, certainly locally, is how we sort of move in step with that national recovery strategy and stand services back up safely, and indeed other sections of society. But in order to do that, we do need several things in place, one of which was access to rapid turnaround testing. So the site at Creekmore and the mobile sites are very much part of that strategy. And Councillor Brooke mentioned the contact tracing advisory service. This is being designed and rolled out over the next couple of weeks, and it will really have several elements to it. The media has already focused quite a lot on the app, which will be used to notify people that they might have been in close proximity to a positive case. a whole series of algorithms within that app that then direct people to request testing. So having the local capability to be able to offer more testing to those people as they start to come through that system is going to be really important as we move forward. The public health team's work, what we're focusing on is really supporting what will be called the Tier 1 work, which is the complex contact tracing. So as Director of Public Health, I'm now a member of the Regional Oversight Board. That links with the Regional Health Protection team. For BCP and Dorset Council, because we've had relatively low numbers of cases in the community, but we have had a lot of outbreaks in our care homes. And if you take that together with the national requirements now for every council to pull together a comprehensive care support plan, you can see that we're starting to put more and more support in place to make sure that we can really respond as quickly as possible to those priority homes and really have comprehensive management and support in response to them if they start to have further outbreaks. So that's going to be very much the focus of the public health team's work, working very closely with adult social care colleagues and CCG colleagues. And I'd fully echo comments that Graham and the leader made around just the way that we're working across the system. I think that close collaboration and cooperation has been really, really good, not just through the LRF, but in other subgroups as well. The only other thing I was going to mention in response to testing was the opening up of thread testing for asymptomatic residents of care homes. Again, this is another really important part of the strategy. Public Health England have realised the importance of asymptomatic residents in care homes transmitting COVID. So there will be the ability for larger homes to request comprehensive testing of all their residents. That'll be via the Pillar 2 route. And that'll be part of our care home support package plan as we go forward. So as those plans are drawn up over the next couple of weeks, we'll be working on a priority list of our local homes to go forward and access that comprehensive route to testing. Happy to pause there and take questions, mindful of time.
Thank you very much, Sam Crowe. I don't have any members indicating that they wish to ask any further questions. So at this stage, thank you very much to Sam for the update, along with Councillor Slade and Graham, who I'm sure we will hear more from later on. We'll therefore move to the rest of the COVID operational responses, the first of which will be in the children's and families area. So I'll invite Councillor Sandra Moore to give us an update again on what progress has been made since the last meeting, and then I'll open it up to questions from members of the board. So Councillor Moore, thank you for joining us.
Yeah, thank you, Chair. I can give you the updated information you requested at the last ONS board. You asked me whether the level of workforce is sufficient, and I can confirm the Children's Services workforce is averaging around 69%. This is sufficient, but obviously at this time of year it's including some staff who are now taking annual leave. You asked about the level of new referrals, and I've been told I need to change that for technical reasons to contacts, as not all contacts become referrals. I can advise that the number of contacts to children's social care remains at a stable level. We had 223 contacts as at the 10th of May, and that was reduced from 249 previously. And the themes emerging from those contacts include food poverty and domestic abuse, but levels have not significantly increased. The updated information on continuing practical and emotional support provided to care leavers, that children in care and children in need, is that they are also being provided with food bags, and that includes toilet rolls, soap and nappies wherever necessary. The participation team, personal advisors and youth workers are also helping with this. We aim for weekly contacts with care experienced young people whenever possible. To ensure young people are informed of what support is available, we have posted 3 times a week on Instagram, plus texting them and their carers. We've contacted all our care leavers who are away at university and college, because we know that nationally this group are struggling, so we're helping wherever we can. We're We've worked on safe online and social media communications with our care leavers, and they have weekly quizzes, competitions, blogs, etc. to keep connected. We continue to see an increase in the number of vulnerable children attending school. Last week, 15% of children overall are in school, and this includes 22% of children on a child protection plan. This was an increase from the previous week. So BCP is definitely not an outlier. In addition, 30% of children aged under 5 and on a child protection plan attended an early years setting last week, which is also an increase from the previous week. The most common reasons children are not attending school are parental choice due to concerns about catching COVID-19, plus self-isolation due to health concerns. We continue, though, to work with parents, schools and early years settings to challenge this, where we believe attendance at school or settings to be in the best interests of the child. We're working with partners to provide clear communications to young people and families through school and early years settings on how to access support services like mental health, and we put out a range of comms to schools, and the corporate comms team send regular email newsletters to families. A weekly send newsletter is also being sent direct to parents and carers who have asked to receive it. Social media is being used to inform families about support services that they can help during the crisis, including information on mental health and well-being, all available on the BCP Family Information Directory and website. The EdPsych service has produced a support guide called Looking After Families in BCP and is currently offering a twice daily telephone consultation line. They're also issuing further guidance to schools regarding supporting staff and pupil well-being during transition and reintegration arrangements. Partners, including health, are contributing by sharing information which we then share and publicise via comms channels. Further to concerns raised at the last ONS board from the Youth Parliament, I can confirm that those members of Youth Parliament have been supported to create short videos on managing the impact of isolation. They have a weekly newsletter on Instagram and Twitter which contains a variety of links to get further support, for example on mental health. So to conclude, I thought I would give an update on the school situation. The government wants children in early years settings, reception, year 1 and year 6 to return to school after half term. You'll no doubt be aware nationally of some of the union's reaction about schools opening, plus comments from the Children's Commissioner and concerns being raised by parents. However, locally, I am told, although school reps are anxious and would have liked longer to plan, the head teachers do want to make it work, and BCP is hosting regular meetings and workshops with heads, with the trust CEOs and the Regional Schools Commissioner, because obviously most of our schools are actually academies, and that's all to help them welcome children and staff safely back into school. And if I can just add on a personal level, I think safety for pupils, families and staff must be the top priority. The risks will vary in different schools, so there is a need for local control and decision making. And I would like to see children back in school for a short time before August, as for some children to receive no education or contact for 6 months is bad educationally and for their holistic well-being. And I've also understand, because the pupils and students have told me that in transition years, they told me this themselves, that they would like some time at school both to say goodbye to their friends and to visit and familiarise themselves with their new school. That's probably my update, but I think Judith might want to add to this. Thank you.
Chair, I don't have anything specific to update. I think Councillor Moore has walked through the range of services. I'm happy to support Sandra Moore with any Councillor Moore with any questions.
Thank you very much, Councillor Moore and Councillor Ramsden. I will in a moment go to Councillor Richard Burton, who's here both as the representative, the chairman of the children's panel, but also today as a substitute member. But I'm going to abuse my position as chair. I do have a couple of questions that jumped out at me during the update, which hopefully you'll be able to help with. The first of which is, Councillor Moore, you talked about the reasons, and it's obviously, first of all, positive to see that more children are in school, particularly those vulnerable children, week on week. So I think we can all agree that that's positive. But you outlined that the most common reasons why children are not in school were, to paraphrase, kind of parental choice through anxiety around health, etc. It's understandable, but just I wondered how you knew that information, where that information, how you were gathering it, and where it was coming from. I've got Judith indicating.
Right, sorry, I was just going to add that from personal experience, it is actually because they've been telling me that they are too worried to send them to school. But I'm sure Judith's got a better answer.
Thank you for allowing me to come in, and just for the record, I'm very happy to be an esteemed councillor's company, but I'm not a councillor, and I think that title was used in one of the speaking moments there, so just for the record, I'm not. The Children's Services, we ran a snapshot survey, Chair, of parents that we were working with within children's social care in order to understand better what were the real or perceived or system barriers which were part of the lower number of children who were vulnerable being in school. And Councillor Moore is quite right, we're not an outlier either in the southwest or in terms of the national position with regard to the percent of vulnerable children in school, but it felt important to us to understand what were the reasons. So we ran a snapshot survey, and it also enabled us to understand which schools we might need to support more to welcome back vulnerable pupils, and that's proved to be a successful way of working, and we saw some changes through support offered and real joint working with some particular schools, which we managed to put in place following that small snapshot survey. It also is very helpful to understand how important the messages are to parents in sharing the science and the how risks are managed for children, and that's a local issue, and I know it's been mirrored in the national thinking as well.
Thank you very much, Judith. Just second question from me, directed, I suppose, at Councillor Moore. Again, you talked about, and I fully agree with the stance that many children want to be at school. I think we have a duty to kind of ensure that some education, if it's safe, is available to them. And I also understand that obviously many schools are academies, so outside of the kind of parameters of our control. But I have 3 young children, and one of my children's schools has indicated via letter that they will not be opening on the 1st of June. And I just wondered, you mentioned obviously that head teachers want to work with us and in the spirit of cooperation, but just wondering what powers are available to us if schools essentially do not take the government advice or advice from the councils.
Yeah, thank you, Chair. I think that's more of a question for Judith than it is for me. I know that the RSC and the heads are really helpful on this, but the reasons Judith will elaborate.
Thank you.
Chair, thank you. I'm happy to come in here with the professional and technical information. We speak at least weekly with the Regional School Commissioner. We've got a very strong partnership between BCP and the Regional School Commissioner, and of course that's really important in our context with the high number of academy schools. We are working across the partnership, I have to say, regardless of the tenure, because they're BCP children, and that's our role as the local authority to champion their need to access education, their need to access, in this context, safe learning environments. So we are working very closely with the Regional School Commissioner and speak to her and members of her office at least weekly. So there's lots of other conversations going on which are influencing conversations. You can appreciate this is about influencing leadership rather than a straight line mandated position. The straight line mandated position would be from the Regional School Commissioner in regard to academies, but you'll note that that isn't the that isn't really the tone of the communication or the partnership that government or indeed BCP is seeking to adopt. It is through support and challenge and understanding what the barriers might be. I know that some of our head teachers are working through a phased return, with the 1st of June being the start of that, so that they can indeed offer access to safe education. And if any particular school has written to our teams indicating that they won't be opening, they are in the absolute minority, and we're working through that on a school by school basis. But none of that has been escalated directly to the Regional School Commissioner at the moment for action.
Thank you very much. At this point, I will pass over to Councillor Richard Burton, who's the chair of the Children's Panel, to see if there's any comments that he wishes to make. Councillor Burton.
Thank you very much, Chair. Partly some of my comments and questions have already been answered, particularly looking at the number of children, vulnerable children who are attending. I've noticed that the numbers are going up. I've also noted the assurance that we're not an outlier, which I think is one of the concerns that a lot of people had at the last meeting. Can I just ask, the data we're using from other authorities and our data, are we assured that it's the same type of data? Are we comparing like numbers with like numbers?
Judith.
Chair, if it's helpful, I'll come in there. I think we're comparing as much as we can, like with like. The DFE published, and they don't use these words lightly, an estimated national average of vulnerable children attending last week, which was around 14%. And I think that when I spoke to some of the management information experts who also liaise with the DFE, they didn't use that word lightly. But of course, it is in regard to the fact that some definitions of vulnerability have been applied slightly differently, because the government mandated the ability for us as local authorities to support schools, offer places to children that the heads or the local authority thought were vulnerable but didn't yet have a social worker, and we would support that. So of course there is that space. The national DFE have issued an estimated number, but in terms of the judgment, are we an outlier? We have that conversation weekly with the Department for Education, and who are representing the South West, and we've also shared that data with colleagues around the South West. So we've got a triangulated view at the moment that we are not an outlier, but that doesn't mean that we're content, and we continue to work to support more families whose children are vulnerable in a range of ways gain access to safe education in this period. That is continuing to be a priority.
Thank you very much. I have 3 more people wishing to speak, so I'll move on to Councillor Iyengar, and if there's any further time, I'll bring you back at the end, Councillor Burton, if that's all right. So, Councillor Iyengar.
Yeah, thank you. Can I come back to the children's services? Councillor Moore, I think you gave the figures at the beginning, which was the new referrals or new contacts, 223 versus 249 previously. I hope I noted that down correctly. Just a theme of this discussion so far has been about actually thinking about the longer term or several months ahead and which way the trend is going. So they're the figures now. Which way is the trend going for new referrals, new contacts? And tell us something, please, about our ability to cope with it.
Councillor Moore?
Yeah, thank you. Yeah, it's going in the right direction, which is good. Yeah, I expect you're worried whether or not there's going to be a spike as lockdown measures are lifted. And as I understand it, this might be mitigated by measures being phased over a period of time. For example, the return to school being staged by year groups, which should help the situation. And currently I understand there is capacity in the system to deal with such an increase, but clearly this needs to be kept under review as circumstances change. Is that helpful, and whether Judith wants to add to that?
Councillor Iyengar, I'll come back to you first. Are you satisfied with that?
Oh, okay. Does Mr. Ramsden have anything to add to that, please? Does any detail, anything more?
Sure, I'm happy to come in. I think that we know that the contacts during this period have remained fairly steady. We're content that we have indeed received them during this period as a check and balance to people know where to go if they do have any worries. We have made some changes in practice, which means that the conversion, if you like, from contacts into referrals into which families need a social worker were planned to be less this year, because we've wrapped around early help systems and services around families that are identified to be in need. So that strategic objective means that we're more satisfied and content that we will have capacity in the following months should a spike be experienced in the numbers of families in need of help. All of that being said, the multi-agency partnership, which is very strong at the moment, Graham Farrant talked about that at the start of the meeting, and that's very true in the children's arena, particularly at that front door. We're also very curious about how community resilience has been supported, how family strengths have been identified and supported. And we're seeking with partners over the coming months to identify what they are and how we capitalise on that, so that some families won't need a social worker in the future, because the early intervention and early help services will be able to wrap around them in real partnership with health services and schools. So we are looking at the long term. We do, like all other public sector agencies, anticipate an increase in the demand and the identification of need, but we don't think it will be a straight line through into statutory social work. It will be into the system of multi-agency support that we're seeking to identify and then embed in terms of some new ways of working during this period.
Okay.
Thank you very much, Judith and Councillor Moore. Two more speakers to get through, and I'm very conscious of time, so if you could have short, snappy answers, it'd be much appreciated to try and get through today's very full agenda. So I have Councillor Rigby. Councillor Rigby, thank you.
Thank you, Chair. I'll try and make it a short question as well. All it is, I've had a number of parents speaking to me about the fact that with schools looking to reopen on the 1st of June, that if they were to choose to not have their child go back, or they didn't want to, as we administer the fines for absence as BCP, are the schools looking to stop those fines if parents choose to keep their children home for safety? Thank you.
Thank you very much. I think I'll direct that to Councillor Moore. I think I've seen some government guidance coming around on this, but Councillor Moore.
Absolutely right. There has been government guidance on this, and they have said that there will not be any fines if they choose not to go.
Thank you very much. People really taking on board short and snappy answers. Let's keep that up. I have finally in this item, Councillor Green. Nicola Green, Councillor Nicola Green.
Thank you, Chairman. I'll do my best to be short and not snippy, but it's a slightly more involved question, I'm afraid, than Councillor Rigby's. I'd like to thank Sandra Moore very much for her update, but there were some elements of the update that could have been given, I think, an awful lot more quickly. We asked those questions nearly a month ago, and in deciding not to go ahead with an interim meeting between that one and this one, I think there was an expectation from members that some of that information would be provided in a timely fashion. So if anything should arise from this one, I'd be grateful if that can be seen to. But broadly, my question is around what we don't know, as I was asking last time, and thank you for the information about what we do know and how we're finding out more. But how are we staying in touch with the 4 out of 5 children on child protection registers who are not at school? And can you also just be, for reasons of clarity, I know of some schools where they're saying, yes, we're in touch with these children, we're seeing them, but actually they're seeing them once a week. When we talk about how much school these children are missing out on, we need to be absolutely clear about how much they may be falling behind in their education. And I note that some of the referrals that have been coming through have been about food poverty, but increasingly we're hearing about an access poverty issue to, an access to education issue around poverty, whether that's around technical support or access to the internet and so on, and how children from less affluent backgrounds are receiving considerably less education over this period of lockdown. And therefore, I'm just wondering if you can give us a bit of a guidance about how the local authority is helping the schools to ensure that those children, especially our most vulnerable, are able to catch up. Thank you.
Councillor Moore.
Yeah, thank you, Chair. Yes, I remember from the last meeting that it's the potentially invisible children that are the concern, and obviously I have been asking Judith lots of questions about the children that should be in school or would be better if they were in school. And I do know that the schools are visiting and the social workers are visiting, but I suspect that Judith will be able to give you a more detailed answer than me, because it's a service that she's responsible for. Thank you.
Okay, thank you. And apologies if you didn't get some information from the officer team there, Councillor Green. I've noted your request there also. So there are two key elements, and I'm conscious about trying to be snappy. It was a complicated question in terms of I heard two key elements. One was access to learning and access to quality learning, and how were we addressing some of the barriers there? And you're right to reference that there's no mandated scheme for any schools, whether they're academy or maintained, about offering virtual learning or offering book-based learning. Now, the government has started a scheme which is to address some of the lack of access to IT for vulnerable learners, and that includes children in care, children in particular year groups who are socially disadvantaged, and we have made full use of the application to that government scheme in order to gain kit for our young learners, as well as the dongles, which is to do with the internet access. We, like a lot of local authorities, were allocated the maximum from the scheme, which is approximately about the third of the need that we identified. And we haven't yet received the kit. We're not an outlier in that. That's just how long the national scheme has taken to be operationalised. But we're hopeful in the next week or two that we will receive the kit, and we've got the logistics already set up to allocate that kit to children. We're also working through how do we meet the shortfall from what was on offer to actually the level of need that we have in our community. I'm very happy to bring briefings back or outside of this meeting in relation to that particular work stream. There was then another question about children in terms of were they seen or were they not seen? Children that we're very worried about are seen weekly, if not twice weekly. And that's not just children on a child protection plan, it's also children who have a social worker who, in terms of the legal definition, would be classed as children in need. And the social workers continue to complete risk assessments and update risk assessments. And indeed, we're working with partners to ensure that they are also involved in that, not just in terms of seeing children, in terms of safe and well checks, but also now the pandemic is going beyond an emergency crisis into a new normal for a period of time. How do they formally ensure that they are fully taking part and discharging their duties in terms of risk assessments for children who we've identified to have higher level needs and or risks may exist? So happy to talk a further point, Chair, Councillor Green, but I'm conscious of time. But they're my two headline responses to what I understood and heard as two separate but linked questions.
Thank you very much. Councillor Nicola Green, you wish to come back?
No, I would though like to receive those further updates.
Thank you very much. I think that's noted. In which case, thank you very much to Councillor Moore and to Judith Ramsden from the Children's Services Directorate in the Council. We'll now move on to the next service area which we're considering, which is adults and health and social care. And I will invite Councillor Leslie Dedman once again to give us a very brief update on the progress that has been made and an update on the Council's response since the last Overview and Scrutiny Board meeting 4 weeks ago. Thank you very much, Councillor Dedman.
Yes, thank you, Chairman. I don't know that I'm going to be that brief. I'm sorry about that, but I have quite a bit to say. And I would say, first of all, I want to thank all our staff. Our staff have been working flat out and for everybody in this pandemic. And not only that, it isn't only our own staff who are under pressure, but as you can imagine, with adult social care and health, we've got a lot of carers in the community. we have been reaching out to them, and not only to advise where to get help, which has been a very, very good initiative by Comms. We've sent out a lot of help through that, but we're actively supporting them. Our day centres aren't open, and I'll go on to that in a minute because that's one of the easements that we've performed. But we've got an innovative range of online activities. It's difficult to say online activities, but and it's social events. It's things like gardening classes. We've got photography classes. I'm told we've got Pilates. Now, I'm not sure how that works. I haven't dialed into it. We had a VE Day celebration. So as you can tell, we've got a lot going on. And we've got a lot of good feedback, and especially from people, carers especially, obviously. They're new to the technology, and the chairman mentioned this brave new world. They're really embracing it, and it's very interesting to see how that is now coming along. We are in this brave new world, and we're making the most of it. And to go on to the day centres, that's in line with the Care Act 2014 easements under the Coronavirus Act. And our Director of Adult Social Care agreed to 3 Level 2 easements. And that is one of which is the day centres and services are closed due to social distancing. As you can appreciate, there is no way really that we could have kept them open. So the other provisions are in place. As well as what I'm saying, Pilates online, we've got other provisions tailored to each individual person. Lots and lots going on. I'm posting out of things like a clay to do clay modelling, which sounds absolutely wonderful. It's a really an idea I would never have thought of. So thank goodness we have officers who think of things. And in that, I have been asked this question before about charging. We're only charging for that when the support which we are giving is equal to a day centre session. So some of that will be charged for, obviously, if a lot is going on, but most of it, I believe, won't at the moment. So that's one of the easements. Another easement has had to be the sensory loss team. As you can imagine, again, that can't be delivered by phone or video. So that's another easement that we have taken. And thirdly, some adaptation work on houses to fit them for disabilities or the needs of people. That has been delayed because of the distancing again. So those easements are going to be continually reviewed. And obviously when we can step them up, then we will step them back up again. One other thing, not so much concerned about the easements, I think, but safeguarding referrals. We've had a rise in the number, which is only to be expected in a pandemic. This is a very, very odd situation for everybody. One thing I would mention is that there have been some concerns about self-care and the mental well-being of people in the community, which is sad. And I think, again, due to the pandemic, due to the oddness of this situation we're coping with. And I would say that that's all being followed up just as it would be if we weren't in the pandemic. So there's no worries about that not being taken on board and dealt with. We've heard a lot about hospital discharges and the need to free beds for COVID-19 cases, and these are nationally mandated arrangements. And the council, the adult social care team, has fulfilled the discharge needs. We had plans put in place very early on, which I think I might have mentioned at the previous meeting, block bookings in the care homes, block bookings for home care. And we have managed very well to do that. So we have not been in any way blocking beds in hospitals. The hospitals have been clear. And I think almost finally, I can see the chairman frowning a bit in the picture. No, he's all right. Thank you, Philip. Yeah, but the care homes, I would really want to say that. I think Sam touched on it. We've had 55 deaths over BCP in the care homes from COVID-19. And I must say that although you're saying 55 deaths, it's a number, but each one is a really, really sad loss to the family concerned. 29% of our care homes have had an outbreak of COVID-19, which is not good, but equally, the Southwest average is 27% and the national average is 37%. So I'm not saying that I'm not commenting. I'm just telling you what those averages are, which I think Sam mentioned. We are supporting the care sector. It's ongoing. I'd really be interested to read the results of the PPE committee. The council, I've got a figure here. This is why I'm concentrating on my screen. The council has distributed over 55,000 items of PPE, personal protective equipment, I must say, for anybody who doesn't know. And of that, 28,500 is face masks. Now, can I just say here a personal feeling on this, and I'm sure that the Working Party have found this, there was a lot of confusion about whether you should wear it, whether you should not wear it. We see lots of people in other countries wearing it. Why are we not all wearing it? So I think that confusion has not helped. But we are providing PPE if the home's own suppliers have failed. So in other words, we're the supplier of last resort. Finally, you'll be pleased to hear, the government initiative to support care homes to provide effective infection control is going to be 600 million. As far as I'm aware, and I'm sure Jan will pick up on this, it will be distributed by the councils with 75% allocated on the number of registered beds and then 25% at the local discretion. And this is to cover staffing costs associated with the new infection control regimes, staff self-isolating, that type of thing. Philip, I have rushed through that, so I'm going to hand over to Jan so that she can rush through her bit. So I'll leave mine there for now. Thank you.
Very grateful, Councillor Dedman. I'll move to Jan Thurgood now to fill out any gaps that have arisen. Thank you, Jan.
Thank you, Chairman. Thank you. So the only things that I just wanted to add further, I just want to clarify the percentage of our care homes that have had an outbreak. The report said 33%, and there was some confusion around PHE's allocation of homes between ourselves and Dorset. So I just wanted to confirm today that the published figure from PHP for outbreaks in our care homes is in fact 26%, which, as Councillor Dedman said, compares with the national average of 37%. The only other things I just wanted to pick up on is that on the 14th of May, the government issued guidance to local councils and our partners, which has required all partners to submit on the 29th of May a local care home support plan. That will be a formal document and will be published, and I have no doubt will be of interest to all members, particularly those on the Health and Social Care Committee. And I further just wanted to mention in relation to support care homes that there's been an initiative that every care home will be offered PHE, Public Health England, training in terms of infection control, and that will be provided by specially trained trainers, and the council has put forward 7 trainers for our area, which include environmental health officers and adult social care quality officers for care homes, and also clinical commissioning groups have had to nominate a named clinical lead for every care home, and that was achieved for our area on the 15th of May. So I wanted to convey that the support for care homes is very much a multi-agency support wrapped around care homes. And the other thing to say is we're working very carefully with our care home and indeed all our providers, and really listening to what matters to them.
Thank you very much for the operational update, Jan. I will first go to Councillor Northover, who's the chair of the Health and Adult Social Care Committee, to see if she has any input first. Councillor Northover.
Thank you, Chairman. I have just one question really about the safeguarding referrals that you talked about, and you said there is an increase, I think, in the number of referrals. So can I can we just be reassuring to the public that if they're worried about, say, an elderly relative, that we still do have that capacity to go and do the assessment?
Can I just say there, Chairman, I'm pretty sure that's what I said, that we are carrying on regardless. Sorry, Lisa. Yes, I'm pretty sure that I said that, Lisa, but I'll go to Jan for confirmation.
Thank you, Chairman. Yes, we're continuing to respond to adult safeguarding referrals as we would normally, other than to say, of course, in terms of social distancing, we're often working on the telephone or as video links rather than visiting, given the social distancing rules and the medical vulnerability of many people that we're working with. But absolutely, we are operating as normal, and we are directing some additional resources when required to the adult safeguarding teams.
Thank you very much, Councillor Dedman and Jan. I have one further indication of question, which is Councillor May Haynes. Councillor Haynes.
Thank you, Chair. Just coming back to, because I had several questions, but most of them have actually been answered by portfolio holders' presentation. So thank you very much for that, Councillor Dedman. So the question I have relates to care homes. 55 deaths, there's still 55 deaths that really shouldn't have happened. So that's really quite sad. But on that point about the COVID outbreak in care homes, just wondering whether we have an idea of where the care homes have been affected. They've actually been able to effectively self-isolate so that the rest of their residents are remaining safe as far as is possible. And for those that haven't been able to do that, what assistance have we been able to provide them? Thank you.
Shall I answer?
Yeah, Jan.
Yeah. So when there is an outbreak in any home, that outbreak is notified to Public Health England, and Public Health England will then initiate an initial conversation with the home around what are the risks and what should happen. And at that point, there will be a discussion about what then is appropriate. There will be discussions about infection control, and indeed, as Councillor Haynes said, is the home able to effectively care for people and provide care in a contained and isolated situation. To date, we haven't had any requests as a council to do anything additional in terms of those meetings which the council has been involved in, both from public health and adult social care, and we will continue to talk with the sector around infection control measures as we go forward. I think what's very interesting is the recent advice from Public Health England has been around really providing continuity of staff groups with patients in care homes, both within care homes, not using agency staff that may, for instance, that move between care homes. One of the things we've been looking at with care homes is, and the sector generally, is supporting recruitment initiatives. So looking at the new national guidance, particularly the guidance around keeping the consistency of workforce in homes, I think that's where we will want to engage with the sector about how can we continue to support, particularly if the sector does now need to recruit more staff.
Thank you very much, Jan. I have a final question from Councillor Fear. Councillor Fear.
Thank you, Chair. It was just in regards to, I think this question probably be more towards Dan on this one. It's just in regards to certain care homes with certain residents there who have underlying health issues that have had to remain in their room, for example. And it's just around how that can be going for multiple weeks. And it's really around the loneliness and depression of the only people they will see are people kitted up in gowns, etc. And obviously, as we go forward, and hopefully we will be lifting restrictions in the coming months, for example, how we can monitor their those sort of levels of depression and loneliness, and how we can kind of get that back on track, and how we can monitor that, because we could get someone through the coronavirus, for example, if they had it, but then lose them through that kind of isolation period afterwards. And we really don't want to have that if they've gone through that kind of first initial step. So it's just really on the monitoring side of that. I was just seeing if there was any update. Thank you.
Jan, you wish to come in?
Yeah, thank you very much, Councillor Farrant. I think it's a really important question around the mental health and well-being of everybody in care homes. Obviously, one of the first things that early on happened was, in fact, requirements about relatives not visiting, and that, you know, kind of lack of contact, both for residents and for relatives, is really difficult. We've seen some really great innovative practice. So in our own supported living service has seen some really great examples of the use of new technology in terms of making contacts between people. So I think, again, we're seeing some really innovative practice. But I think the point you're raising is a really interesting one. And I'd like to go back actually to sector providers and think about how we can talk with them about that issue and how they are themselves looking at those issues in the long term. And I know that some of our care homes are now thinking around that, particularly that issue of family contact and how they can work with that in a way that's really both safe in terms of infection control, but as you say, really addresses the emotional and health and well-being of people. So thank you for the question, and I will we'll talk with the sector further about your request to how we can monitor it, but also how we can share really great practice in that area.
Thank you very much.
Chair, if I may really quickly, on the next ONS meeting, potentially a little update on that. That'd be great if we've talked to the guys in the other sector on that third sector and see what they can come back with, and then see how we can incorporate that as well. That'd be fantastic. Thank you.
Valid suggestion. In which case, thank you very much. Oh, Councillor Dedman.
Well, no, can I just add to that having been a care home owner and worked as well in care, that I think that Councillor Farrant is quite right, that the lack of interaction with your own family is really, really debilitating in a care home. However, in a care home, in that setting, or even in care in the community, people get very, very attached to their carers. And this is why, this is why a lot of carers do it, because it's an extremely wonderful relationship between carer and the cared for. And I think that the patient will certainly feel that the carer is part of their own circle, whether or not they know, obviously, it's not a family member. But I think that's a very valid point, Councillor Farrant, about the mental. It's no good being healthy if you're not mentally healthy, is it? So I think that's a very good point. Thanks.
Brilliant. Thank you very much to all board members for contributing to the item, to Councillor Leslie Dedman and to Jan Thurgood, Service Director, for that update. I'll move on to the next section within the COVID response phase, which is regarding the tourism, leisure and communities areas. In particular, it's something that we didn't get to explore in the first meeting. So I'll initially go to Councillor Lewis Allison just to give us an update on how items under his portfolio are coping in the crisis, and then move to colleagues for questions. So, Councillor Allison, thank you for joining us.
Thank you very much, Mr. Chairman. So I'm going to start with the community resilience work that's been going on. So we all know that the Together We Can project has been continuing. Since the last update at ONS, the numbers now stand at 10,613 incoming requests, and we've had over 3,300 cases resolved. Since the last update, we've also expanded that so that people can now put their claims in through an online form, and that's had over 600 responses, which is fantastic. And we've also been working to identify vulnerable communities which have not been connected so well with the work that's been going on in terms of helping them. So we've started a community equality champion network, which is with partners to help identify those communities which need extra support or might need some other kind of work to go on to support them. In terms of the future development of that, we know we're looking at, there's some issues going forwards in terms of there was a lot of staff that have been used on the community action network from other places, and as that changes, as people go back to work in their normal places, how do we continue that work? We're also looking at how we continue to support the huge number of volunteers that have come forwards and try and encourage more people to stay in that and stay in volunteering and continue to encourage them to volunteer in the future. I want to touch also a little bit on, in the document, we've got a bit about domestic abuse here. So what we've seen is that domestic abuse figures haven't been reported as being as high as they normally are, which given the current crisis seems to defy logic. And so we've made sure that we've got support available and that we are upping our comms on that to make sure that people are aware that there are places for them to come if they are suffering from domestic abuse. And we're also making sure that when the lockdown is completely released and people feel more comfortable to come out, that we make sure they have the resources to deal with any kind of increased pressures on the domestic abuse side there. In terms of tourism, so we've been working really heavily with the Destination Management Board and lots of other organisations, lots of businesses. We've seen that nearly over £60,000 worth of grants have gone out in terms of the hospitality, leisure grants, etc., small business grants, which is fantastic. We're looking at how the tourism industry is going to recover. It's obviously going to be a very difficult process. The tourism industry is heavily reliant on the free travel of people, and given the current situation, that's not going to be possible. And we're not sure at what point it is going to be possible to retain the same kind of level of business industry that we saw previously. What we've been doing is working with organisations to try and find details about what kind of situation they're in, what kind of different areas of tourism, how they're going to need different kinds of support, and how we can help them in terms of their individual businesses. At the moment, the struggle is going to be is how do we deal with social distancing in places like hotels, restaurants? It's obviously going to be a huge challenge. How do we deal with our open spaces in terms of the tourism industry? It's going to be a huge challenge. What we're doing here is trying to find the best way forward to deal with whatever comes day by day. I'm happy to answer any questions on any other points inside my portfolio.
Thank you very much, Councillor Allison. I appreciate it's a bit more difficult in these areas because obviously a lot of these are looking at things which happen afterwards rather than what is happening now, and particularly with regards to things like hotels and things, we're going to be very much led by the science and the guidance as and when it arrives. I suppose the first question from me, which is about something which is in our control. It was disappointing, although completely understandable, to see the Air Festival cancelled this year. I was very pleased to see the dates confirmed for next year. However, there has been some disagreement, I suppose, around on the future of the Air Festival in the future. And I was wondering what your view as portfolio holder was around the Air Festival and particularly its long-term future beyond next year.
Yeah, so obviously people will be aware that given the current circumstances, all of the events have been cancelled up until the end of August, and we'll continue to review events going forwards after that date. There's some other events in September, etc., that we'll be reviewing to see whether or not they're capable. In terms of the air show, there was lots of debate around this, and there's lots of valid opinions as well. I mean, I'm 26. For my entire life, climate change has been a big conversation. It's always been up there as things we discuss. And a lot of members have raised really valid points about the Air Festival and whether or not it's something that they're comfortable supporting. There's lots and lots of considerations in terms of that event. I'm personally, I've worked in the hospitality industry in Bournemouth, and I'm really aware of how much lots of organisations, lots of businesses rely on that event as a major point of income for them. Lots of them, need those 4 days of really big income to sustain them and to make sure they've got enough cash in their pockets to get through the winter. I am in favour of continuing to have events of that scale. I'm in favour of having events that are similar to the Air Festival. What the work we need to do now is to make sure that we're developing that so that it takes into account really thoroughly, and we've got really good evidence that we are taking into account the environmental impact, taking into account the financial impact, the economic impact on businesses, and making sure that as we move forward, that we're developing that event and making sure that it's suitable for the next generation.
Thank you very much. So just to clarify, as a Cabinet Member for Tourism, you're committed to the Air Festival for the foreseeable future?
Yes.
Excellent. Okay, in which case I have a few other people wishing to speak. I have Councillor Farquhar, and then I think Councillor Slade wants to add something. Councillor Farquhar.
Thank you, Chair, and also thank you for getting in there first on the question on the air show. Really appreciate that. I know that's a great
Sorry,
concern.
it's the Air Festival. I think we have to be very specific about this. It's the Air Festival. You'll get told off otherwise.
I stand corrected. Whatever festival there comes, whether it involves an air element or not, I know it's of great concern to many, many residents. My question relates to the hospitality. As part of my volunteering for the community response is I popped into a local laundromat to do some laundry for a resident, and they are taking a massive hit despite the grant, etc., because of the loss of income from the hospitality for tea towels, bedding, etc., which was a big part of their business, and it's possible that they may well go to the wall, and that's a great concern for a small business employing a few people. My question really to the portfolio holder is, what's your major concern as regards the government funding or grants or whatever it is to actually support such a large element of our income stream, and so many small businesses such as this laundromat which I visited that are affected by the hospitality trade?
Yeah, so I think you raise a really good point there, and that is that the tourism industry is a lot bigger than people expect. I think, you know, it's over £1 billion in business income across BCP. It's almost 40,000 jobs, and it doesn't just impact on the directly what you would think is direct businesses that deal with tourism, such as hotels and restaurants. It deals with a lot of other organisations. It's lots of other people reliant on those businesses. So I think, you know, my major concern in terms of the grants that have been provided is that we've got the grants that are there to help people survive in the short term and to make sure that they can stay afloat while they're in lockdown. My concern is that in terms of the businesses being able to function once they're actually open. So in terms of hotels, you know, if your social distancing measures means that you can only have half your capacity for some of those hotels, for some of those businesses, that's not going to be financially viable for them. It's not going to work for them in the future. So my concern is that we don't see a continuation of that kind of financial support through government to make sure that there's going to be a big gap, isn't there, in between what they would have expected to earn in a normal year and what they're going to earn in this year, even if they're able to open and even if they're able to, you know, handle all of the social distancing measures. So that's my biggest concern.
Thank you very much, Councillor Allison. Again, I'm very conscious of time. We're running extremely behind schedule, so I'll bring in Councillor Haynes for the next question. Councillor Haynes.
Chair, did you want me to answer those questions?
Sorry, is that Councillor Slade?
It is. Or did you want Councillor Haynes to go first, and then I might answer both?
I'll invite Councillor Haynes first, and then if you wish to come in, I'll bring you in then. Councillor Haynes.
Right, thank you, Chair. So very, very quickly, just wanted to touch on the question about the Air Festival. It's just confirmation that actually for the foreseeable future that event will actually continue. And the reason I'm saying it is because it's disappointing, but I do completely understand why it had to be cancelled for this year. But bearing in mind that a lot of people are probably starting to get a bit cabin feverish because they've been in lockdown, particularly those that do not have access to their own gardens, etc., etc. And I think that to have the Air Festival ongoing, certainly into the medium term, I think would actually give a lot of people something to really, really look forward to. But on the other point was, I think, Councillor Allison, you mentioned about domestic abuse. I'm just trying to understand, because you're saying that once we come out of lockdown or it starts to ease a bit more, that you would be preparing for more issues of domestic abuse. I'm just trying to get my head around why that would be the case. I mean, the other point that I think I would be more concerned about was if we have more people able to actually come out, that you might have an issue with antisocial behaviour and what sort of measures are actually being put in place in anticipation of that. Thank you, Chair. That's all my questions.
No problem. I'll go to Councillor Allison first. Thank you.
Okay, thank you. So on the Air Festival, so to be clear, what we've committed to is only next year's dates. In terms of the event's future, I'm very much in favour of finding a way to make it work, and finding a way to make it, suitable, environmentally suitable for the future. But at the moment, we've only agreed formally to next year's date. So the reason we've done that is because we know that next year is going to be really, really vital for those businesses to continue, and that the year of recovery that we're going to see next year is going to be really important. So I felt that we needed to make sure that we confirmed those 2021 dates. I'll be working, with other members to try and find a way forwards, but I'm very much in favour personally of trying to find a way to make it continue. And in terms of the question around domestic abuse, so it does kind of defy logic that you would see lower numbers. You would expect that, given the current circumstances, given that families are in a more confined space during lockdown, that you would see an increase in domestic abuse, and we've not seen that increase in terms of what's been reported to us. So it's about making sure that once lockdown is over, we are expecting to see an increase of, once people feel more comfortable about coming forwards, that they will take up that opportunity. So we will see. I've got Kate Ryan if she wants to come in on that.
Hi, if that's okay with the chair.
Yes, Kate.
Hi, it was just to explain that it's primarily just due to the risk that people feel when they're in the tightest lockdown mode of actually being able to make contact safely with external support. So that's why we're anticipating that as the lockdown eases and people are able again to speak to friends, to seek advice and to contact agencies, and also feel more comfortable potentially exploring options around different accommodation, moving either the perpetrator or the family, that's why we are anticipating the surge. And we're working to ensure that we've got priority within the refuges for local referrals, and that we're working with all of our partners to be prepared and on top of that situation. Obviously also we'll be able to allocate through the normal processes in terms of the housing options if required.
Thank you very much, Kate Ryan. Councillor Slade, you wanted to add something briefly to the portfolio holder statement?
Well, I did, because there's some information there that you probably need to have. Firstly, in terms of the community response, to say that is continuing and is going to a business as usual model, and we're now at 20,000 people that we've actually assisted, both with our proactive and reactive ways. I think that is something that we should be congratulating the staff on, because that is quite exceptional. And we're already talking to the LGA and others about case studies and how we can, work with wider bodies to bring forward this level of engagement with others. The thing I wanted to just cover was around, you talked about business and tourism and hospitality. Lewis won't have been, Councillor Allison won't have been as engaged with this as I have been, but there has been some work in the last week or two around the wider economy, working with the different sectors of business to put together a framework which Chris Shepherd's been working on, and which is being cascaded down through various bids, business improvement districts, chambers of trade, and similar, which is enabling us to find a way forward collectively with our business partners and with the sectors to unlocking the business opportunities, making sure that we are leading on creating the best environment for our tourism and our retail market to come back to life, and how we're bringing those people together and continuing to lobby with them. So I just wanted to add that, because that was really important. And around antisocial behaviour, there's a big piece of work going on at the moment about our CSAS officers who work with the police, and I've got a meeting tomorrow with Lewis to actually look at how we can engage them in the wider social distancing and antisocial behaviour work going forward. So I just wanted to sort of broaden the horizon out a little bit on where that might be going.
Thank you very much, Councillor, for that extra information. I will move on, and thank you to Councillor Allison and to those who took part in that item, to the final item in the BCP Council's response phase of the COVID-19 pandemic, which is an update from Councillor Wilson, who's portfolio holder for housing, to update us on events in his portfolio. So I'll pass over to Councillor Wilson. Thank you very much for joining us.
Hi, thank you, Chair. I will try to keep this as brief as possible because I know you're running behind on time. So overall, I just want to say that, well, firstly, I want to start by saying thank you ever so much to all of my housing team who have been fantastic over this period of the pandemic. Housing teams are continuing to meet high demand across the board. Almost all of our staff are working remotely. And recovery planning is underway across all of the services in line with the emerging government guidance. Just taking you through a couple of headline parts of our service. We still have a high homelessness demand. We continue to accommodate circa 300 singles in temporary accommodation. Some are new placements as people are moving on, so there is a continual flow. We are working and focusing on a multi-agency approach so that they have a lot of support to secure accommodation going forward after lockdown has been eased properly. There's been no notable increase in homeless families as of yet, which is really good news. As I say, recovery planning is continuing to prevent potential increase in homelessness when the lockdown is further reduced. In terms of council housing, both the Bournemouth Council Housing Team and PHP are working very closely together. Thousands of welfare calls are being made to our vulnerable tenants across the conurbation. We are still only doing emergency repairs. However, we are starting to put together some risk assessments in order to see whether we can go back to doing maintenance repairs, but we have to be conscious of the clients and the tenants that we are going into the homes of. So that's happening. Going on to housing delivery. Funding approval to continue new council housing schemes is scheduled, and hopefully we will be coming back in the next few cabinet sessions to bring forward new developments. In terms of actually going out on site, we are hoping to do that soon, but we are reviewing everything, and I think we need a robust process again in terms of risk assessments to make sure that everyone's safe to do so. But I don't want to take up too much more time, so I'm happy to open to questions.
Thank you very much, Councillor Wilson. I'll move straight on to board members for any questions of Councillor Wilson of items in his area. I have Councillor Millie Earl. Councillor Earl.
Thank you, Councillor. So I've been very impressed with the success of council officers and the outreach partners in actually being able to house the sheer volume, 300 rough sleepers, and those who are hidden homeless. And we've heard this weekend that the government is going to end the support to councils, and in the report it talks about discussions with the Ministry of Housing, Communities, Local Government about determining an exit strategy. My question is, what might that look like, and how can we keep rough sleepers who return to the streets safe from contracting coronavirus, or better still, offer support to keep them from returning to the streets altogether? Thank you.
Councillor Wilson.
Yeah, so with that, obviously the news article that came out in the weekend, I've seen that as well. It's quite concerning, to be honest. Last week I wrote a lobbying letter to government to ask for more funding and more support in terms of being able to secure accommodation for those who potentially could go back onto the streets afterwards. However, over the last few months we've been able to assess really well the people who we've put into temporary accommodation, and we've been working really well with other agencies and organisations and charities in order to secure move on and assess their needs in what they need to move on. So we're hoping that through that approach we'll be able to keep as many off the streets as possible. But I did see another article in The Guardian that was from Bob Blackman, MP, heading up the all-party parliamentary group for ending rough sleeping, and he's a Conservative MP, and he has come out saying that the government need to seize this opportunity in order to make sure that people don't find themselves back on the streets, and the best way to do that is through housing first. And I completely agree with him. I think that it's a fantastic opportunity. I think the government have the very commendable goal of ending rough sleeping by 2027, but they could really bring that forward if they give local authorities the support they need.
Thank you, Councillor Wilson. Do I have any further questions from board members of items within Councillor Wilson's portfolio? No? In which case, that was much quicker. Thank you very much to Councillor Wilson. We look forward to seeing the forthcoming Cabinet papers coming forward in due course. Colleagues, that winds up the item 8 on the agenda, which is the Council's response to the COVID pandemic in terms of the now phase. What we've done is split the agenda into 2 parts, the now and the next. And so item 9 in the agenda deals with the Council's recovery and reset phase response to COVID-19. So essentially what comes next. We do have a paper that is being taken to Cabinet next week on this particular item, which deals with the financials, and we're quite this is the bit that we will explore that as well. I think we have both Councillor Brown and Councillor Slade leading on, sorry, apology, yes, Councillor Slade, Councillor Brown and the Chief Executive leading on this item, so I'm not sure exactly how you wish to go at this stage, but who would like to go first?
I'll give you just a bit of an intro, because I think there is it's Councillor Slade here. Let me just turn my video back on again. Bear with me. I didn't want my children walking behind. So I think the important thing to focus on here is that what we have is a finance paper that talks about how we will deal with the reset from a financial perspective, the recovery of the overall council, and how we move forward into the next phase is due to come in a report next month. And we're working through all the various possibilities. That where we are with the recovery right now is, as I've said before, carefully challenging all of the spend, looking at the various areas which need to be considered, which Councillor Brown will go through, but also how we work with our partners in the LRF, the Local Resilience Forum, on the wider perspective, and how we work internally around transformation, and then how we work with our business sector on the economic recovery, which again I've already covered. So there isn't really very much in terms of the recovery phase at this point, because that is coming forward in June. So this very much is around a finance paper, which is what is coming to Cabinet, is a finance paper.
Thank you very much,
so
Councillor Slade. In which case, I'll pass over to Councillor Brown to give us an introduction both into that paper and also the financial actions since we last heard from you 4 weeks ago. Councillor Brown, thank you.
Thank you, Chairman. Yeah, hopefully members all had a chance to read the detailed report that's coming to Cabinet. I'll just give a brief introduction, as this is essentially, it's a financial update report. It's requesting Cabinet to note the report and request further reports to come to Cabinet in June. So there's no specific sort of financial decisions in there at the moment. At the last meeting, we updated the board on the early initial decisions which were made to protect the council's financial position, particularly around expenditure controls and liquidity and our financial management. So this report updates the actions which are being taken to manage the inevitable significant impact on the council's finances of the pandemic. Members will be aware that central government have now provided us 2 tranches of emergency funding totalling £22 million, and Appendix 1 in the report details the return showing how the first £11 million was allocated to cover the additional costs that the council is incurring. Since the start of the crisis, officers have been working extensively to assess the potential financial impact on the council's finances in terms of additional expenditure needed, particularly in adult social care, children's services and housing, as well as the potential reduction in council income, particularly income from car parks, tourism-related income, council tax, business rates. 3 different scenarios for the possible financial impact have been developed based on the lockdown and the recovery lasting a period of 16 weeks or 24 weeks or the full 52 weeks of the financial year. So for financial management purposes, we're assuming a 24-week impact period running up to September, which we estimate will create a £53 million pressure in this financial year before applying the £22 million government emergency funding, leaving an estimated £31 million net budget pressure this year. The report and appendices break this down by service area, and it gives detailed commentary on each budget line where we anticipate a financial impact. The report details our financial strategy to address this impact in our 2020-21 budget and in the medium-term financial plan, and that covers a whole host of areas which we're progressing around government lobbying, transformation, our employee cost base, the expenditure cost base, resetting our services, reviewing projects, our estate strategy, looking at standard accounting practices, base budget reviews, and reviewing our reserves and contingencies. Progress is being made in all of these areas to inform the budget review, which will come to our next June Cabinet meeting. But just to sum up, our financial position is being managed day to day on the basis of our early decisions that we made back in March. The anticipated impact on our budget this year is a moving target, and it will vary depending on government announcements and the way that the pandemic develops. Our work to manage this impact is progressing rapidly in preparation for our revised budget coming before Cabinet in June and full Council in July. Our prudent balanced budget that we agreed in February is standing us in good stead to manage this impact, and we will be making the necessary decisions to deal with this, and we do not anticipate the necessity for a Section 114 statement as several other local authorities are looking at the moment. So, Chair, happy to take questions on that.
Thank you, Councillor Slade, and also thank you, Councillor Brown, for the introduction and update on the finance paper. Colleagues, we're considering the response and recovery and reset phase, along with the specifics of the Cabinet paper for scrutiny. A couple of members wishing to indicate that they would like to speak. Firstly, Councillor Bartlett. Councillor Bartlett.
Yeah, thank you, Chair. It's a question about the reserves. Have we got sufficient reserves to carry us through this difficult spot? I think £31 million should be accommodated within reserves, but I just wondered if you could comment on that, please. Thank you.
Councillor Brown.
Yes, thanks, Councillor Bartlett. Yeah, looking at our reserves and contingency levels is one of the areas that we're looking at as our overall sort of financial management package. We do have approximately £15 million in unearmarked reserves. Obviously, there's a £31 million pressure, but that will be managed in a number of different ways, particularly looking at our expenditure and our cost base and staffing, looking at the transformation programme, but also reviewing the earmarked and unearmarked reserve levels that we've got. So, yeah, we do anticipate that there'll be a variety of areas that will contribute to managing that pressure, but our reserves, earmarked and unearmarked reserves, are a significant part of that. Yeah.
Thank you. Councillor Bartlett, you wish to come back?
No, thank you, Chair. That answers it. Lovely. Thank you.
Thank you very much. Councillor Mellor.
Thank you, Chair, and thank you for the update. David, Councillor Brown, I fully appreciate that everything we've been doing at the moment has been out of date, pretty much as soon as it's done, and that's no fault of anybody. This is a highly changing environment. The current financial analysis you have in this paper, it's a bit of a, I understand it's a starting point, but effectively it's a bit of a blunt tool, isn't it? In terms of the scenarios, 16, 24, 52 weeks, particularly around the different impact on different parts of that. Effectively, the car parking piece in there will not necessarily be on the same, 16, 24, 52 week impact, and it might come across on a more gradual level. So effectively, my question is, will you be asking for finance to undertake a more nuanced modelling exercise than the three scenarios currently modelled? And I'll come back on the second phase, Chair, if I may, in terms of a recovery phase. Thank you.
Yes, Councillor Brown.
Yeah, thanks, Councillor Mellor. As I said, I think it's a moving target, and as I think that you highlighted car parking charges, there may be a shorter or longer term impact on that, and a number of those areas, a lot of it is based on, well, all of those estimates are based on professional judgment and estimations. None of us know exactly how the pandemic's going to develop. None of us know at the moment what government announcements may come out over the coming months. So those numbers will change, but it gives us a very good target to aim for in terms of the sort of quantum and the level of gap that we need to aim to fill. And we're working quite extensively at the moment on looking actually the way that we use our sort of budget setting and the financial modelling to actually inform that. We may, well, we'll see what savings we can come up with, and what use of reserves and contingencies, and what transformation can contribute to that gap. But it will, as you say, it changes day to day, it changes week to week at the moment. So, but yeah, we'll be looking at incorporating that within our sort of financial paper in the future.
Councillor Mellor.
Yeah, fine. So just to respond to that briefly then. So effectively, all I'm saying is the fact is we need to set the context we're working in, and these are massive decisions we're making, and we're having to make them really quickly. And I commend people making quick decisions. But if it's the detailed level of modelling what we need to do on a regular basis, nearly weekly, daily basis, and the way councils work in terms of papers coming up to committees and setting that context, I just urge you to make sure there's more consistent and detailed review of the financial context we're setting in, and that to be then shared outside of just the cabinet group and with the wider councillors. In terms of the second bit, I think it's I'm disappointed to entirely agree with the comments of the leader when she said, and I think I quote, there isn't much around the recovery phase at the moment. That's coming in June. When we had this meeting a month ago, I think it was we were advised by Graham Farrant, and it's very much it's this phase is around the officer led. But then my point was, well, the members need to be taking more of a building role for this going forward and leading on the recovery phase. I believe I'm right in saying we still haven't had anything around the recovery task group that was talked about north of a month ago. So I would ask for something to come on that. I'm not going to comment on the recovery phase if there's nothing to comment on, other than that I'm disappointed that we're taking that long to look at it. But David, thank you for your comments on earlier, and I do appreciate the difficulty in the modelling.
Councillor Anger next. Councillor Anger.
Yeah, thank you. Councillor Brown, can I just clarify something about the paper that's going to come in June? We've got the 16-week, 24-week and the 48-week scenario. Will you be bringing a 24-week and a 48-week scenario, paper covering both of those, to the meeting, please? I've got a couple more questions, Chair, please.
Councillor Brown.
Yeah, thank you, Councillor Anger. At the moment, with the work we're doing, we anticipate bringing a budget review looking at the 24-week scenario, which is currently a £31 million anticipated financial gap. So that's what we're looking at bringing forward in June. But that said, things do change day to day and week to week, and based on our experience over the coming weeks as we're sort of working through that process, things can change. But at the moment, we're basing it on the 24-week scenario. We feel that's a fairly sort of prudent scenario in terms of some service areas will be impacted for a shorter time than that, some may be longer. So yeah, on average we feel that's a prudent approach.
Okay, so can I ask then, to avoid us having to go through another budget revision given the uncertainty, what thought was given to bring in a 48-week scenario as well, so that we can with some reasonable assumptions amidst the uncertainty, I'll grant, but with some reasonable assumptions through to the end of March, we can do one budget revision with at least some confidence that we're not having to redo it all again.
You're right. I don't want to be bringing sort of budget reports to Cabinet and Council on every couple of months as we sort of revise our sort of estimates and gain more information. So we're looking at bringing something forward which is flexible, which can deal with however the scenario turns out during the year. Okay,
just one more question. Again, it's just a clarification, please, David. The in the paper that's submitted, I think the 24-week scenario, there's been some sort of bottom-up sort of science in that from the discussions I've had with officers, but the movement from the 24-week to the 48-week scenario looks like it's almost just a doubling. It's not quite a doubling in all the figures, but it's almost a doubling. It almost looks like the same formula has been applied to every figure, just to multiply it by almost 2, just to get to the full year. I'm not meaning to be disparaging generally. Is that what's been done? Is it just a blanket assumption there, or are you telling me that something sort of more scientific has been done with the 48-week forecast?
It varies on the different areas. Some will be fairly sort of straight line, some will be different. Obviously, with the summer period coming up, particular areas, if with the 24-week scenario, looking at the impact up until September, things like our tourism-related income will be particularly impacted with losing the summer season, so that will be skewed differently. So yeah, some of them will be on a sort of straight line basis, the similar impact depending on how many weeks it goes along, but some are a bit more nuanced in terms of the way that income is received through the year.
Okay. Thank you. I think just a final comment, Chair. I think in the previous meeting, the leader and the chief executive used the word reset. That was introduced some time back now, and just a flavour of all of this and in each of the portfolios is how we are, how we're actually moving forward with that, the reset of what the council is, and not just in the budgeting, but in each of the portfolios. Right. Thank you.
Thank you, Councillor Iyengar. I also have an indication from Section 151 Officer Adam Richards, who wishes to speak as well.
Yeah, and thank you, Chair. I think it's just to come in and give some reassurance in the sense that clearly we base the financial projections that will be taken forward to June on a 24-week scenario, and that 24-week scenario is based on generally the end of August and a little bit of a transition in September to normality. But clearly it is a very dynamic situation, an ever-changing situation, and clearly whatever we do, whether that's in May, June, July or August, we're going to have to keep this constantly under review as we go through the year and potentially act fast and swiftly to counter any impact of COVID-19 as we go through that year, because I don't think anybody, hand on heart, can say exactly how this is going to pan out, and therefore we just need to be vigilant, constantly review the council's financial position and act accordingly to keep it within that balanced position going forward. Also, to just give you some reassurance, there is more scientific approach than just doubling the 24-week to come up with the 48 or the 52-week scenario. I think the 24-week scenario looks at something like about a £2.2 million a week issue. The 8.5, and I think that just reflects the amount of income that we generate during that summer period, and that's been taken into account. But with all of this, we're going to have to keep it under constant review, and take action accordingly as the impact of COVID-19 on both our local community and on our nation unfolds.
Thank you very much, Adam Richards. I have one final person wishing to speak, Councillor Mellor.
Thank you, Chair. I was just to say that it would be useful then to actually have a look at the more detailed science behind the report. So if and to also understand if regular reviews of this context setting has been undertaken, how that will be shared at a more timely basis and just through the normal committee process.
Chair, if I can just basically respond, Appendix 2 to the report does set out each of the scenarios on the main budget areas as to how they're impacted under both a week 16, week 24 and week 52 scenario. So that does provide some of the baseline information that's probably requested as part of that process.
And a comment around how we'll be updating other members around the, as you I think you've indicated, Adam, that you'll be remodelling on a nearly daily basis. So how does that get shared? At the moment, we've got one context, which is the 31 million quid. That's the main thing we're working to. I think that's already a little bit out of date, understandably, after the car parks were opened on the weekend, so on Wednesday. So we need to be moving in a more swift way in terms of sharing information and reviewing it as a councillor group, and I just request some thought is put into that, please.
Thank you very much. In which case, I think that draws to a close the this part of the scrutiny session. Thank you very much to all of the portfolio holders, participants, and indeed members of Cabinet, etc. We've looked at both what the Council is doing now for the COVID response, and also a little look into the future. And I'm sure that that is a piece of scrutiny work that will be continuing for the foreseeable future. We will now move on to the final item in this, our first of two Overview and Scrutiny Board meetings for today, which is item 10, the Scrutiny of Children's Services Capital Strategy Cabinet Report. And I'll invite Sandra, Councillor Sandra Moore, back to introduce the paper briefly. Thank you very much, Councillor Moore.
Thank you, Chairman. Well, this paper follows on from the paper I brought to the April Cabinet, the capital investment to increase SEN capacity. We brought this paper early in view of its urgency and said we would provide a further detailed capital strategy for children's services. The purpose of this paper is to agree the longer-term capital priorities, provide an overview of estimated funding to deliver these priorities, and propose an internal governance process to approve decisions re school premises. Capital programme for 2021 consists of 16.5 million approved spend across the conurbation. The programme includes 2.1 million for SEND capital projects already approved at the last Cabinet meeting. Item 3 lists the capital projects yet to complete. Any unspent capital from 2019-20 will be added to the 16.5 million currently approved. And it's estimated that we will have 3.9 million unallocated government capital grant available to fund future schools and children's centres capital projects. And Appendix A refers to this. This funding is ring-fenced. 1.9 million basic need funding, 1.8 million school condition funding, and 0.1 million SEND funding. And this allocation has obviously been approved at the last Cabinet meeting. So new capital projects include 1.9 million basic need funding, and page 176 and Appendix B on the report refers, and that includes the Poole North feasibility study. There's 100,000 allocation, because we've got 3 large housing developments are going to be built in this particular area, and estimates indicate there will be a need for an additional 2 forms of entry in the primary sector. So a study will look to see whether any existing school can be expanded or whether a new school is needed. We also need to provide additional capacity at St Aldham's. 460,000 to 610,000 has been allocated, and there's 2 parts to this project. One is to remodel the existing space to make it more suitable, and 390,000 has already been agreed for this work through delegated powers, as it's a matter of urgency because they need the accommodation for September. Also, the addition of a 4 classroom modular block to increase capacity from 150 to 180. There's also Ocean Academy remedial work. 50,000 has been allocated, and this is a newish primary school which requires some remedial work, and the council's share of the cost was previously agreed by a predecessor council when the school was built. The work is needed to complete the legal transfer to the Academy Trust. So then we go on to 1.8 million capital maintenance, and that's on page 176 to 177, and Appendix B refers. Condition funding allocation includes 100,000 to carry out condition surveys at 17 schools and learning centres. Condition works to maintain schools, and an estimate is yet to be prepared, but it's to carry out work costing under 100,000 for schools. Condition works for children's centres which require work, and £10,000 has been allocated to that. Condition works to Linwood School, there's an estimate to come, but to a maximum spend of 150,000. Emergency condition works to main schools, health and safety issues, and 50,000 has been allocated to that. And lastly, the 2 special schools, Winchelsea School, there's 100,000 allocation for feasibility plus, as the school is a combination of sufficiency, suitability and condition issues, with a large amount of existing provision delivered through temporary accommodation. Basically, the school has a capacity for 96 students, and we need to make it more suitable for the 120 students who currently attend, and to find out what is actually possible on the site. And Linwood School, 100,000 allocation for a feasibility study to carry out suitability improvements, and again to find out what's possible at the site. Lastly, I do need to mention the governance process, which is in line with BCP financial regs, and that's the approval process for new capital projects arising from feasibility work is 1, the project's less than 100,000 in value and they can be approved by the service director. 2, projects over 100,000 but less than 500,000 can be approved by the executive director with approval by the corporate management board. And 3, projects over 500,000 but less than 1 million require cabinet approval. And 4, projects over 1 million require council approval. And I would also add, because I think it's quite important, that ward councillors will be contacted regarding any school or children's centre projects taking place in their ward. So in conclusion, the 3.9 million government grant figure, as mentioned earlier, is before the government announcement of new grant funding post-2021 is known. The proposed spend in Appendix B ranges from 1 million to 1.5 million, leaving up to 2.4 million unearmarked for new projects outside the current strategy. And there are additional projects not included in the current capital strategy, but which may need funding in the future, and they result from the feasibility studies mentioned in Appendix B. Historically, legacy councils have drawn upon non-government grant funding, supported borrowing, capital receipts, SIL and 106 contributions to help finance capital projects. And given the current competing pressures on BCP council resources, it is likely we will have to seek SIL funding in order to help finance projects arising from feasibility studies and school condition surveys mentioned in Appendix B, and supply school places in line with statutory duty. So this paper is to go to the next cabinet meeting on the 27th of May for discussion and approval. Any questions from that? I'm happy to attempt to answer them.
Thank you for that introduction, Councillor Moore. I have 3 colleagues wishing to indicate to ask questions. I'll start with Councillor Stephen Bartlett. Councillor Bartlett.
Yes, thank you, Chair. I was surprised to see at paragraph 14 that there's a potential conversion of the Bournemouth Learning Centre into a school. Given that there are already 2 very large schools in the immediate vicinity, I wondered if you could just tell us a little bit more about the idea behind that. And also, you touched on this as well, are the ward councillors aware? It is on the boundary of my ward, it's actually a different ward, that are those ward councillors aware of this proposal? Thank you.
Yeah, thank you, Councillor. Yes, they are looking into creating a special school at the BLC. It did actually used to be a special school, but it was closed in 2000. But this is currently work in progress. And I did check to see what the ward councillors were concerned, because I thought it was you, but it seems it's just outside your area. But no, they haven't been consulted at the moment because it's still very much work in progress. But if any decisions are going to be made, then obviously yes, they will be, because it's very important. But what it is, it's about creating another special school because of the the usual, we want more places. Okay.
Councillor Moore, can I just comment there? Is that okay? Sorry, it's Neil Goddard here. I'm covering for Judith Ramsden as she's had to leave. Just to let members know, the announcement about BLC was made today, so staff, ward councillors and those renting space at the centre were actually informed today. So just to give you an update, that actually happened today.
Neil, it's overtaken my updating. Thank you for that.
Just so you.
Oh, sorry, is that Mr. Goddard?
It is. Hello, Chair. Yes.
So yes, there was anything further to add?
Nothing from Sandra Moore said. Special school and consultation has started. That was all.
Fine. Councillor Bartlett, you wish to come back?
Well, I think Mr. Goddard's just answered the question whether it was a decision that's already been taken or whether it was one that's going out to consultation. But he's just said that it's going to consultation. So thank you.
Thank you very much. I'll move now, as I should have done to the start, to Councillor Richard Burton, who's here both representing the as chairman of the Children's Committee and also the substitute member today. Councillor Burton.
Right. Thank you, Chair. I'll keep this brief because we've got shorter time. I mean, first off, I am very interested about the work north of Poole, because of course that's my ward, and I'm ward that. Am I back again? Yeah, I'm very sure that will be talked as a ward councillor on that issue. I'm just curious about the Winchester School and Linwood School. At the moment, they're both oversubscribed and they're both very well thought of by inspectors and locally. If there are too many pupils going to that school, what happens to them at the moment if they don't have the places?
Councillor Moore.
Well, the proposed schemes at Winchester and Linwood are around feasibility to better understand what may be possible on the site. And obviously we are looking to improve the existing facilities. But if they, at the moment, we haven't got sufficient SEN places for our pupils and students, so they are looking to go to private providers, and obviously that's been a bit of an issue, as you know. So we are trying to build the extra places so that we can give parents a proper choice as to where they actually go to school.
Right. So, thank you very much.
Thank you, Councillor Moore. Two final questioners I have. Councillor Nicola Green. Councillor Green.
Thank you, Chairman. I wasn't actually going to speak on this issue, but having heard the discussion about BLC, and as a former ward councillor for Wallace Down and Winton West, which is where it's cited, I have to say I'm rather disappointed to hear that the ward councillors hear about it on the same day that the occupants of the building itself, and some days after this paper has been published. Just in terms of not only good governance, but achieving a good outcome, then speaking with ward councillors well upstream is definitely going to get you a better outcome. They do know the area very well, they will understand, and indeed I'm sure they would be terribly supportive and helpful to the project, but just informing them this late date, I would say, is perhaps a misstep. The point that I did want to make was around Winchelsea and Linwood. I'm very pleased that further investments going into intended for two special schools, which certainly need it. Some of us go back far enough to building schools for the future, when of course Winchelsea was included, but lost out as the scheme was reined back. But on the point of Linwood and the high cost of feasibility which is being considered for both of those projects, Linwood is quite well known to the local authority. I'm surprised it will cost £100,000 worth of feasibility to investigate what could be done. I know it's a difficult site, it's a split site, but it has had £1 million spent on it quite recently, so I'm surprised at the amount that's required, and would just ask that those figures are perhaps looked at again. Thank you.
Thank you, Councillor Moore.
Yeah, well, can I just comment on the ward councillors' consultation? And I totally agree with you, and I have raised this issue. I honestly believe that, as in Poole, and I expect it happens in Bournemouth, the ward councillors were consulted right at the start, because as you say, we have the local knowledge, and I did raise this, and I think it's been taken forward now. So I think I will pass on to Neil the questions about the amount of money, though.
Mr. Goddard.
Thank you, Chair. Thank you, Councillor Moore. Members will be aware that Linwood is a very complex site. It's a split site across the road, and requires significant investment to expand in any way and to bring it up to the standards that we would like it to be as a building. The school do an outstanding job with the building they have. Councillor Green's already mentioned the view of Ofsted and others, I think, about the school, but there is a huge amount of work to do. There is some invasive investigatory work that is required. But I can assure you that we will look to minimise that cost, and we will draw on the work that we've done previously in looking at Linwood. But it is quite a complex site, and so this is what you might consider a worst case scenario.
Thank you very much. Councillor Nicola Green, any further questions?
No, thank you very much for the answers.
Thank you. In which case I have the last questioner, which is Councillor Brooke. I believe you have 2 questions. Councillor Brooke.
Fine, thank you, Chair. I'll be as quick as I possibly can if I can present them together, and then either Councillor Sandra Moore or Neil Goddard could respond. There's been a lot said on Winchelsea and Linwood today, and the work that's being suggested there raises an interesting element with regard to what we're supposed to be doing today in terms of approving a 3-year strategy, in that all the financial details are for the current year, and all we've got is a possible 2.4 million carryover into 21, 22, 22, 23. No attempt at all at ballpark figures for any of the work that is being suggested, and also lots of new projects being referred to, but no details at all. I'm a little bit concerned that we have nothing at all available in the way of details for the next 2 years when we're looking at a 3-year strategy. That's the first question. And the second question is related to the sustainability impact. I really applaud the sentiment expressed in the paragraph in the report, which is paragraph 17, about the work that is being done to increase school places should reduce car movements, and thus reducing the school run and benefiting the environment. However, do we have any control at all on that as a result of parental choice? Because parental choice could mean that we actually have an increase in car movements rather than a decrease, and therefore how are we going to actually monitor and manage that at the appropriate times? Thank you.
Thank you, Councillor Brooke. I'll go to Councillor Moore first.
Yeah, thank you, Chair. Well, I'll have a go. The protected capital funding, which is shown in Appendix B, is what the council has been allocated, and you're correct to say that we're not forecasting future allocations because this is subject to policy and formula changes. And at present, as I understand it, the DFE are looking at reprioritising resources to support councils and help them meet the high needs block issues. And so historic allocations might not be a particularly good indication of anything that we made in the future. But I do take your point that this is meant to be a 3-year strategy, but I don't really want to get into the situation we had previously in Poole, where you had zero capital and deficit budgets and all the rest of it. As far as you want me to go on to the transport, unless Neil, do you want to comment on that bit first?
Only to say that the feasibility works is obviously in place to identify the costs that might be achievable in the future, and that would fill out the three-year plan. There are aspirations within the strategy about what we'd like to achieve, but as Councillor Moore has said, that's reliant on future funding announcements. And so this is the level of detail we think is useful to support at this point, but obviously we'll come back with greater detail as we move forward.
Okay,
so we go on that one. Thank you.
Okay, so if I go on about the issue around transport, I mean, yes, the parental preference will have an impact on this, but the policy only funds homeschool transport where the council are not able to offer a place at a nearest school within the distance that will qualify for support. So parental preference doesn't necessarily lead to increased homeschool transport. For the SEND provision we're hoping to create, we are able to name an appropriate school on the EHCP, and where this can meet need, parents can challenge this, but given the quality of our local provision, we are in a strong position to defend this position. So where we do have to transport children with SEND, these tend to be longer journeys. and, because that's where they have to access the appropriate provision. And it's obviously more costly because then we have to use passenger assistance. Therefore, if we create provision locally, we should be able to make savings on the home to school transport, as well as reducing the high needs block spend. Is that okay?
If I can just come back, Chair. Yes, no, I think that's fine. I wasn't thinking so much of the home to school transport as personal car movements. So thank you for the that information.
Thank you very much. In which case, I have no further board members wishing to speak on this item, so thank you to Neil Goddard and thank you to Councillor Moore. Colleagues, that brings us to the end of our meeting, certainly the end of item 10 and the end of the first of our two Overview and Scrutiny Board meetings today. Thank you all to all of those who have participated. Thank you to members of the board. Thank you to those that have joined us online, members of the press and public. And I look forward to seeing those of you who are interested, and certainly those board members, at our next meeting, which will take place in an hour and a half's time at 6 p.m, where we'll be considering the cabinet related items due to be presented to the next cabinet meeting. So thank you very much for joining us, and have a good afternoon.